Boom, chakalaka, boom, chakalaka, boom, boom, boom. Um, all right, we're gonna start this thing. Yeah, so that's
I'm excited to go to San Diego. I haven't been in a while.
I know. I
How's
love
the
San
weather?
Oh, it's terrible. You shouldn't come.
Yeah, it's so terrible.
I'm sure everybody who lives in San Diego is probably like, yeah, don't let anybody come. It's absolutely gorgeous, man. It's like always, right?
As long as your hotel room isn't right next to the sea lions, you're good.
I don't think there's sea lions at this venue, man.
Yeah, yeah.
I mean,
Well, my wife and I's room was right next to the water, and pretty early in the morning. It wasn't all day, but early in the morning, they were having a blast.
oh, absolutely. As they should, right? You are staying where they live.
That's true. Yeah, I'm encroaching.
Yeah, no, we're actually at a completely different venue. We're on Coronado Island, looking at downtown this year. So it is still on the water, but uh, no harbor, no sea lions. It's
I'm
up.
excited. I'm excited.
We're
It's going to
super
be awesome.
excited. Yeah. All right. Hey, we're a couple minutes past the hour, so let's get this thing going. Welcome everybody. Want to say thank you for being here. Michael Cowen, Todd Warren, and Dr. Jarrod Cornehl. We're going to talk about TMD tonight. If you're here to talk about anything other than TMD, you could stay, but we're probably not going to answer your question. Uh, as always, if you guys have been on our webinars before with Awaken to Sleep and or Dental Sleep Profits, you know that we're here to serve you. We want to hang out, have a good time. We also have plenty of questions that have been submitted and written up for tonight, but we're here to answer your questions. So if you're here live, we'd love to start off by hearing a shout out from you. If you tell us where you're from, the chat is already open. I promise. We already hooked that setting up. Uh, in the chat, if you would tell us where you're from, where you're tuning in from tonight, we would love to hear that.
Yeah, I'm excited to see how far and wide this webinar is reaching.
Got
Gilbert, Arizona.
Arizona.
Ooh, that sounds nice compared to Oregon this time. Oregon is we are entering our gray phase right now. This is the beginning where we get mixed weather. So I would love to be in Gilbert, Arizona.
Well, yeah, but Dr. Herr in Arizona, Mr. Rockstar, you know that you're just exiting your season of the Gates of Mordor. So everything is melted, turned to dust, and finally settled just in time for the Haboob monsoons to come through, right?
Mordor.
Yeah, he's at 105 degrees, 80% humidity. Todd, I'll take your gray zone any day of the week.
Yeah, yeah. I don't feel so bad now.
Yeah.
We
Concord,
got
North
Texas in the
Carolina.
house and North
Fort
Carolina.
Myers.
Yeah.
Oh, North Carolina is beautiful.
Spicewood, Texas. Wayne, thanks for joining us. We appreciate you being here. Hot Idaho? I don't know. Nobody from Arizona
Oh,
or California is
Dr.
feeling bad
Smith,
for you.
Dr. Smith, I was just in his neck of the woods like 3 years ago. I was in the Owyhee Canyonlands on the border of Oregon and Idaho, and I think Meridian, Idaho is like just over there.
Yep.
Yeah, it's a cool area.
Still nobody's feeling bad for you, buddy. Sorry.
No. Hey, Randy, how's it going?
Yeah. Well, hey, let's kick it off. Todd drew the short straw. So he is going to be the question asker tonight, but we're going to keep it light. We're not doing a whole bunch of questions on slides and all that kind of formality. One thing though that does have to be formal here for CEs. Awaken to Sleep is hosting this and issuing the CEs. You guys know what this looks like. If you're only here for CEs, then you have to stay the whole time, click the link in the chat, take the survey, and it will send you a CE certificate by tomorrow. I promise. And if you don't have it by tomorrow, it'll be in your spam. Please check that before you email us. But yeah, we're here to hang out, answer your questions. We're talking all things TMD.
Yeah,
And Todd, you've got the intro, so you want to take it away?
let's do it. Let's do it. Well, first off, I am So grateful, so blessed that Dr. Jarrod Cornehl had agreed to do this webinar with us. Dr. Cornehl, thank you so much.
Absolutely. I'm
I'm
excited to be here.
excited to bombard you with these questions, and I'm sure the audience has a lot of questions as well, and even more will arise as we kind of casually go through this conversation. Um, and as we were mentioning, kind of off the recording, Dr. Cornehl, your list of accolades is quite lengthy. So I wanted to just, I would love to hear your story, your passion, what got you, like, how were you introduced to TMD, and kind of the story of how you got to where you're at now clinically and with your practice. I would love to hear that.
Sure, absolutely. I love telling my story. So, well, first and foremost, I'm a general restorative and cosmetic dentist by trade, right? And I've been practicing dentistry for 23 years, and I'm the owner of Dental Studio SF in San Francisco. And for the past 11 plus years, I've been focusing on TMD pain management and facial aesthetics. And I kind of just stumbled into TMD along the way. I landed in aesthetics about 17 years ago. It was 2008, and I was going through what my friends and family would say was my first midlife crisis. So I woke up one morning, I looked in the mirror, and I could see my crow's feet. I could see lines and wrinkles. And so I immediately jumped online and tried to find the soonest, closest injectable course that I could because I needed to learn how to do botulinum toxin to take care of my lines and wrinkles that I was starting to see. I was 34 at the time, and I wasn't going to have any of those wrinkles. So I started, I found the course. I slowly started dabbling in facial aesthetics, not only for myself, but for friends, family, and colleagues. They were all wanting it as well. And it wasn't until a few years later that I actually just kind of fell into TMD pain management. I was at a dinner party with friends, and one of my friends, she told me, "Hey, Jared, I need to come in and see you for Botox. My migraines are coming back." And I said, "Your migraines? What do you mean your migraines? I've been treating your frown lines and your crow's feet lines." And she said, "Yeah, ever since you've been seeing me, if I no longer get headaches and migraines, and unless I go too far in between sessions with you." And so I didn't really know what to tell her at the time. So I said, "Sure, no problem. Let's just text me next week and I'll get you in whenever it's convenient. I can squeeze you in anytime." And uh, so I would spend the next few years trying to figure out that connection. And I can share that a little bit later if you like. But TMD and facial aesthetics actually do go hand in hand. A lot of the areas where there's migraine centers or where patients are getting headaches are in the aesthetic zones. And if we don't know how to um, treat those areas, we could drop their brows or drop their eyes. We could make them look really funny, and they'll never coming back to you. People are more vain than that. They'll suffer through the headaches and migraines, but they don't want to look bad. Um, and if you don't know how to do that, then you're just not fully able to take care of these patients who really need the pain relief. And so once I found the different mechanisms of action of how botulinum toxin work and started combining some of the treatment modalities together, I was really able to start helping these patients, and especially those that have been suffering for so many years. So
Yeah,
that's
yeah,
my story.
that's
That's how I
cool.
got into it.
That's cool. Well, you mentioned something that kind of goes along with one of my first questions. You mentioned all the different treatment modalities that go along with that, and being in TMD for a while now, from a marketing perspective, there are a lot of schools of thought, a lot of different. Well, I studied under this person. I studied under this person. Um, what do, how do you approach that? How do you approach the clinical side with patients? Obviously, you're focused on aesthetics, and that has kind of coincided with TMD as part of your story. But what's kind of your philosophy behind treatment? Because I hear a lot of different philosophies out there.
Right. And so you ask five different dentists, you're going to get six different answers every single time. It's tough because there are so many different ways to get to that end point. And some people or some providers, some dentists are really stuck in just their lane, and they're not able to maybe help every patient right away. These severe pain patients who have been suffering for many, many years, they just want relief. When their traditional methods like oral appliances, for instance. That's probably would say that is the gold standard. What most people would say that that's how they treat TMD is oral appliances. But what happens when that didn't take care of that patient's pain? Or what happens when they weren't willing to try an oral appliance? Like they're bad sleepers. Or they tried it, but it made them worse. They weren't ready for larger procedures like doing orthodontics, right? So there's ortho too that you could get into. Moving teeth around, get a better occlusion. And
Yep.
what occlusion camp are you in?
Yep.
Are you Pankey, Spear, Coyce, etc., right? They weren't ready for ortho. They weren't ready for full mouth reconstruction, or they just really wouldn't accept another new appliance. That severe oral facial pain patient that has been to their physician, their ENT, their physical therapist, acupuncturist, chiropractor, massage therapist, and a handful or two of other dentists, and they show up with a Ziploc bag full of oral appliances, and they're just desperate for help. They just want their daily quality of life back. And so we can, whether we begin with this approach that I teach and that I'm passionate about, is really starting with their pain, getting the patient out of pain, using a combination approach with lasers, photobiomodulation, trigger point injections, therapeutic botulinum toxins for those patients who have a muscle problem, and then using platelet-rich fibrin for those who have true joint problems. We can really help these patients now and not have them suffer while we're all going along this journey together with the patient to figure out the why. And that
Yeah.
journey is going to be different depending on the practice philosophy. Um, Airway, sleep, right? Occlusion, you name it. So there's so many people focused on one, but what about that, those patients when those traditional methods are aren't working or when it's not helping fast enough? We can really help these patients immediately, fairly quickly and easily, getting them out of pain and then go on that journey together.
Yeah. Yeah. And have you seen a willingness in patients, um, just from the multitude of patients you've seen, have you seen a willingness to move forward with one treatment over others? Like, is there uh, more friction when looking at orthotics, surgery, appliances versus injectables? Do you think there's more friction there than with injectables?
Um, I think it can be, there's friction when it comes down to cost. And if a patient has already spent, they have that Ziploc bag of oral appliances or orthotics, and they've already spent 4 or 5 thousand each, why is yours going to work? Okay. Versus the one that I'm going to make. Why all of a sudden would mine work? And those other six, probably amazing dentists, it didn't work for that patient. So cost is typically the barrier to getting treatment. What even with injectables like botulinum toxin, there's a cost to the product. There's cost to doing ortho. There's costs to doing sleep appliances and managing their airway. And so I think that if we can just get the patient out of pain and gain their trust, and then go along your normal pathway of dental sleep medicine or airway or what have you,
Yeah.
um, when they can think straight and they trust you and they know they're in the right place, that seems to have been my approach, is to gain their trust at the beginning and to just help them live a better daily quality of life from the
Yeah.
get-go. And then they're all adults. They can choose when they want to start that journey, but I know we can get them out of pain. So,
Yeah. No, that's a great philosophy. I like that approach. What do you think, maybe aside from the barrier of cost to the patient, what have you seen in your experience working with a lot of other dentists? What do you think is one of the biggest barriers to them actually growing their TMD practice?
uh, yeah, I think it was for me at the beginning. It was fear of being able to manage these patients who are it's they're complicated and they've been in pain so much and so long that uh it, it almost felt at the beginning when I was starting to do this that they were difficult to manage as a patient. And so I think that fear got in my way at the beginning. That's why I was like, I'm not dealing with pain. And I think a lot of dentists, I get that as a comment for me. Well, I don't want to deal with those pain patients. They're a nightmare. Mike,
Okay.
I know you work with tons of sleep docs, right? What is their barrier?
Well, I mean, nobody ever has the cost barrier. Like everybody just gets a yes on the first. No, I mean, we'll redirect back to some of the. I think it would be helpful for the audience to have us sit on the cost conversation of how to
Yeah.
overcome some of those things. But Jared, to answer the question, I mean, one, it's trust. When you got to build trust first, that's foundational, just like what you said. Then it's you've got clinical competence and you need communication competence. So it doesn't matter what you know unless you can communicate that clearly to the patient, where you've communicated care and then your competence. So I think a lot of it comes down to competence in communication after that trust is built. And then it's overcoming that financial hurdle with value versus what it's costing them dollars or time, etc.
Yeah, I
Yeah,
I agree. And you said communication skills. That's really important because we tend to talk to patients like they understand these big words. And so if we can change these words to laypersons, make them simple, relatable language so that they understand, they also feel more comfortable and they're more likely to accept treatment.
yep,
Yeah, well, Jared, I'm so glad you said that because that's one thing I've touched on a lot in the content that I've created is how important communication is when you're speaking to a patient, communicating to them in their language. And a good rule of thumb is speak to someone at a fifth grade level instead of if you're doing sleep, instead of saying we're going to advance your mandible, you can say we're going to move your jaw forward or occlusion, it's like we're going to adjust how your teeth meet. you know so yeah, I'm really glad you said that because I've analyzed being in sales and marketing for a very long time. I've analyzed those fears in depth, and what a lot of people do in order to make up for that fear is they'll tend to increase the clinical complication of their speech. It's like you're trying to prove to this person how smart you are in hopes that that is what will get them to move forward. When in reality, you know, like you said, it's trust. Like trust is number one. And how do you get someone to trust you? They have to know that you understand their problem and you have to be able to communicate that back to them in a way that they understand. So that was a really great point, which I'm glad you made. Um, Kind of while we're on the topic of skill sets, communication being one of those, what skill sets outside of clinical skill sets do you think that TMD dentists should focus on to to either initiate or create more growth in their TMD practice?
Yeah, outside of those communication skills, right, are huge. Being able to, um, I think when I used to just be the one talking during the consultation, and I had to just learn to sit back and listen. And I want them to tell me their story and their, how their symptoms and, what led to them coming here and really listening and making them feel heard and not feeling dismissed. So um, I think, when I have a patient come in for TMD, a pain patient, it's about an hour visit. 45 minutes of that is just a conversation. So you need to be comfortable sitting eye to eye with your patient, communicating, but listening. And yes, you can help drag some information out of them, but really make sure that they feel heard.
Yeah, yeah. And do you, I hadn't asked before, Dr. Cornell, do you have a large team that is also trained well to have those types of conversations, or is it mostly you?
It's mostly, I would say, the doctor, the dentist. So obviously we have our front desk setting expectations, financially, et cetera, at the beginning and getting them comfortable to make that appointment. But all those other skills are done, by either myself or my associates who I've trained to be able to take care of these pain patients in the practice.
Okay, okay, that's great. Um, Looking back at your personal growth curve with TMD, what do you think you would have changed and why?
Oh.
I know that we're getting super deep right now.
Todd, you want him to come back, right? Come on.
Um, I wish I didn't have that fear at the beginning, and I wish I would have jumped in earlier, and gotten trained in these more advanced modalities, and even learning more about occlusion and airway. I wish I would have done my sleep mini residency at UCLA earlier in my career. I wish I would have known about. I was spear trained. My associates are COIS trained, but I wish I would have. There was people that were fourth year dental students that were already there, and I felt so far behind because I was like, these guys are going to be such amazing dentists. They're already here learning. So I think I would have, if I would have known, what I know now, if I would have known then, I would have just educated myself and got rid of that fear that pain patients aren't um, difficult to manage or treat if you've got the right tools in your toolbox.
Yeah, yeah, that makes sense. Michael, have you kind of seen similar needs either, I mean, in your business or the dentist you're working with? Like you have a unique advantage of kind of having a bird's eye view of their entire business.
Yeah.
What would you say would be a necessary focus as well? Like if you could collect all the regrets and like I want to change this about how I grew my TD pain, what would you do differently?
I've got two completely different answers for that. One is a compilate answering your direct question, compiling all of the regrets or I wish I had done it this way to answer that. I think I've also got a completely separate one for myself as a coach. Um,
Okay.
so first, I think right out of the gate, knowing what are you getting after? Like starting, Stephen Covey, starting with the end in mind and then walking the path backwards to your actions for today. If you are looking to only treat patients that have muscular TMD issues, then you don't need to focus on joint degeneration issues. You don't need to focus on the PRF aspect of this. You're really only dealing with stress, appliances, Botox. And I'm not the doctor here. Please, let's yield to Dr. Cornell's expertise here. But like knowing what your desired outcome is matters before you spend marketing dollars, before you go to CEs, and if you're going to CEs to test the waters and see what you like and what you don't, what resonates and what doesn't, that's fantastic. The purpose is to figure out what you want to do, what you don't want to do. But I would really hesitate saying, "Hey, let's go put this on the website. Let's go out and advertise for this. I think I want to," or the next action is without any thought towards what you're trying to get out of that action. That's the coach in me that sees all of these folks that have eventually done great work, sometimes it's a little bit harder and more challenging to get there to the great work. More clarity on that is significantly better on the front end.
Yeah. Yeah.
But
And
on the
from a coach, from if you said you had another point of view.
yeah, this is the one that I'm like, I'm trying to answer this because I'm putting myself in Dr. Jarrod's bucket here. Like, you just asked what he would change. Like, hey man, how have you screwed up and what would you have fixed? Like that's really the translation of what you asked.
What's your biggest fear in life, and how like what
Uh,
mistakes do you have?
a webinar when somebody asked me this. No.
Shoot.
Uh, my answer to that actually as a coach is really understanding who the person is that I'm coaching and that they're not all the same.
Mm,
Like every client that I have has unique goals, a path to get there. Those differences absolutely matter. If I've got somebody in Jarrod in your practice, high-end aesthetics practice in downtown San Francisco, and you're not taking Denti-Cal, Medicaid patients, you're not taking in-network PPO. So if I coached you and said, hey, this is the way that you get every single person in on a free consult, and this is how you're like, Mike, this absolutely not. Because this is destroying my schedule. You've got a practice that's already built that ebbs and flows and breathes how it should because it exists that way for a reason. So to add this in the way that jives and directly connects with your practice is crucial. So one size doesn't fit all. That's easy to say from stages at conferences, but one size doesn't fit all. And if you know, here's the coach in me. If you're a doctor on the call and you're not some of the folks I see the names are already clients of ours, great. If you're not and you're doing this on your own, please make sure that you start with the end in mind and you filter other people's recommendations for you and your practice through the perspective of this is who you are and this is what your practice does. Does this fit you? Yes or no? Those are the two most crucial things you could do with this and pretty much anything else in the practice.
yeah, yeah. No, that's a great perspective, Michael. I appreciate that. Real quick, and I know Dr. Smith asked a question there in the chat, which we'll get to. It kind of goes along with my next question, and Dr. Cornehl, you've touched on this a little bit, the importance of communication, the importance of that active listening process. 45 minutes of your 1 hour consultation is listening, gathering, understanding the patient's goals and things like that. If you could give someone a process for getting a patient to a yes, like let's move forward, what would be, in addition to maybe the listening aspect and just great communication skills or improving communication skills, what would you say is some of the kind of pillars that you employ in order to help patients get to a yes when you're confident that what you provide can actually help them?
Right. I think making sure, okay, if you're wanting to get into these modalities, you can't just, well, you can go and get trained and get good at doing this, but if your front desk team members don't know what the heck you're now offering and they're not on the same page, we used to do this all the time. We'd be so gung-ho about, whatever procedure that we were going to do, but no one else knew what we were talking about or doing. So your front desk team, the face of your office, the first connection that usually a patient has, whether it's a phone call or a chat or email, text message, you name it, they need to be knowledgeable about pain, TMD, and they need to know the modalities that you offer. So that's one. Second, I spent my beginning of my TMD career doing free consultations, and patients were coming in wanting help. I was offering them a combination approach with toxins, trigger point injections, lasers. I spent an hour with them, um, and they would say, I tell them the treatment plan, the cost, and they would say, "Yeah, okay, I'll think about it. I'll come back later," and they'd walk out the door. So I spent a whole hour educating them, wasting my time. I want to help them, but I'm also a business owner, so I need to keep the electricity going and pay payroll, make payroll. So I changed to an approach where I actually charge for my consultations now, and it's a prepaid appointment that they pay prior, at the same time of making that appointment. But what really I was seeing is patients were sticker shocked in the chair. They thought they were going to be able to be cured or helped for $100, $200. And
Mm.
so we changed the way we approach that. And so we have an email like template that we use when a patient makes a pain appointment. And we let them know what's going to happen at that appointment, what their consultation and examination fee entails and costs, and then what the range of costs would be for therapeutic toxin, because that is the hugest part of the fee is to pay for the product. And so we would give them a range. It's going to be $800 to $1,400, and so they could be sticker shocked at home and let them think about it, talk to a spouse or what have you, a partner, and then finally come in and be ready to do treatment on that same day. So that is huge for me, is setting financial expectations ahead of time, not in the treatment chair, because if once they're in the office, they're already sold, they're going to do the treatment. They want treatment same day, consultation, exam, and treatment, and then they're financially ready for it too. So everyone does their treatment
Yeah.
that same day once we change that model around. So uh, I it works. It's worked out really well for us. And I think as if I was a patient, it would totally work for me too. Now I know what to expect, right?
Yeah,
So
yeah. Well, I think that's one of the advantages in the treatments that you provide is you are able to offer quite literally same day relief. Like
yeah,
that's a huge advantage over. I mean, I'm not saying that orthotics and things like that don't work. Obviously they do, but you take your scans, you send it off to the lab, and you got to wait a while for it to come back. And yeah, I think that's awesome. And obviously, the urgency, what I love from a marketer's perspective, where sleep, sometimes you have a patient come in that's snoring and they come in for their consultation because their wife's going to divorce them if they don't do something about it. It's somebody else pushing them to do something. Where with TMD, there's a much higher level of urgency because of the pain that their physical pain that they're experiencing. So you do, and maybe you've seen this, you see a higher willingness to invest in the treatments that can get them out of pain because that pain is such a high motivator for them.
Yeah, absolutely. They get immediate results from the lasers and the trigger point injections, and then it takes just a few days for their toxin to kick in. But what I've found is that patients they're coming to us, at least my practice in San Francisco, because they've consulted Dr. Google and they have heard that Botox can work for these, types of treatments.
Yeah,
And most of the time it is a muscular problem, and if it is muscles, we can use toxins and trigger points and lasers. Um, and so we started marketing to that. Just and so we were marketing, TMJ Botox. And guess what? The phone is ringing off the hook because these ever since, I don't know, especially in San Francisco, ever since COVID, everyone's been so stressed out and anxious, and they've been clenching and grinding and breaking teeth and natural teeth and whatever. And so their symptoms seem to have just gone off the charts. And
yeah,
so by us marketing to them, because that's what they're searching for anyways, we're able to capture more of those pain patients and then take those pain patients and make them true dental patients. Okay. So it's a different revenue of income. So we've got our general dentistry and our cosmetic dentistry, and we've got our pain, aesthetics, and then they all should end up being one of the other in some way. Our general dentist, hopefully, they're going to do a general dental patient should be a cosmetic dental patient. Our pain should be a general dental patient. So it really works well that way. I don't know how the marketing that you're doing, Todd. I'd love to ask you a question finally.
yeah, yeah. Let's go for it. Let's go for it.
And
You
then
know,
when
like,
you guys are with that, I want to come back to the beginner's point of view because I know there's some folks on here that are starting that journey. They are not
Yeah.
that popular and they're definitely going to do a free consult. So we'll get
Yeah.
to that.
Sure.
So
I
let's go
was
on the
just
marketing.
curious as if people are marketing, but and also you might said, don't jump in and like start marketing this if you're not trained and you're not on board with all of it. But how, we were able to really get a lot more patients by able to working with AbbVie and Allergan and Google AdWords or whatever to be able to use terms like Botox cosmetic.
Yeah.
And so I was just curious, if you're able to do that as well, or if you guys are
Yeah.
doing that.
Yeah, with targeted social media advertising, as long as you use like let's say you want to use the term Botox specifically, as long as Botox is in all capitals and you're using a registered trademark symbol, you can utilize that term. The advantage of targeted social media advertising, specifically, Facebook, Instagram, um, is that this phone is listening to our conversation right now. And I would not doubt that within the next 24 hours, because we are talking about Botox, and even, Jarrod, I asked you, hey, can you get rid of these 11s right here? I guarantee you within the next 24 hours, I'm going to be seeing ads for some sort of facial aesthetics because we're having the conversation. So when people are having migraine and headache pain or ear pressure or ringing in the ears, jaw clicking, limited range of motion, they can't chew the foods that they love, or head, neck, and shoulder pain as a result of that muscular tension, you can quite literally get ads in front of those people when they're having those private conversations. So it's very, very effective. And like we talked about earlier, the urgency level is very, very high because of that pain that they're in. And the frustration, like you mentioned, Dr. Cornehl, is they've seen the ENT, they've been to the acupuncturist, they've been to the chiropractor, the massage therapist, their GP, they've gone through their entire roster of healthcare providers. And you come in and you're wearing your red cape and you're there to save the day. So it is really neat to see the urgency and the response, even to like what you said, a paid assessment. Because of that pain and that urgency, people are willing to pay up front for those consultations to see if you can provide them relief. So yeah.
Yeah. And Mike, I know, I didn't have paid consultations at the beginning of exams. I did it for free for many years. My time became, less and less in the practice, and I needed to make sure that those patients showed up and that they were ready to go and not, sticker shocked.
Yep.
So,
Amen to that.
yeah.
I think there's a lot of things. My hope in that was there's a lot of different there's a lot of different folks in different places on that journey, where you are at that tail end of you're the lecturer that teaches everybody how to do this. You've been there and done that and honed this and really crafted that in the practice. If you could try, I know it's been a minute, but if you could rewind that mindset back to, hey, what is I mean, I already put your link in the chat because some people were asking, where do I start my TMD education? I am a tremendous fan of yours for the online videos that you put together that are gorgeous and the in-person courses. I mean, we have a private course just for our pivot group at our upcoming masterclass. Raving fan. So if you guys want to learn about this, learn about it from Dr. Cornehl. He's got an awesome menu of courses. You can check it out on his website.
Yeah.
Dr.
Thank you.
Cornehl, Jarrod, if you would rewind that back for us, just give us some insight on doing those initial consults, gaining your clinical confidence in these different procedures that you started doing over time. What were a couple of like the pearls as you look back, like, oh, I did that and this in reverse, not what you did wrong and you wished you had done different. I'll ask the nice question first. Like what were the steps that really just, oh man, that worked when I did this new therapy, or I how did that work for you when you were getting from the beginning to where you're at today?
Yeah, like you said, like I would do something and it would work, like photobiomodulation, um, standalone treatment. And the problem with that is that I had to treat that like physical therapy. they need X amount of treatments over X amount of weeks. And I also have a business, right? I need to charge them every time they come in. They only, dental patients, they think that they only need to be charged 2 exams per year because that's what their insurance will pay for. And so, luckily, all this stuff that we're talking about is non-insurance based. It's all cash, and they're happy to pay for this. But I digress. Sorry. Um,
Good.
so, so, um, gosh, just lost my train of thought. Um, so, so as as I was beginning, I was doing these other modalities, like lasers or just trigger point injections, kind of letting the patient dictate what they would want, and that usually based on what the price was, to be honest.
Mm,
And then I realized, we know in facial aesthetics, when we can do combination treatments, we get much better outcomes. So I just started stacking these things. What if we could do a laser treatment, do photobiomodulation, and start, increasing blood flow, decreasing inflammation, and healing the muscle fibers at a cellular level, and then come at it with trigger point injections right after. They get immediate relief of the, acupuncture effect of the needle,
mm,
and then at the same time, the same needle deliver the therapeutic botulinum toxins. And 4 or 5 days, once that kicks in, usually the results from the laser and the trigger point are going to last that long. Now they feel immediately better before they're even walking out of your office. You can see it in their eyes. They know they're in the right place. They're excited to pay for that toxin when they walk out the door because I kind of gift them the other stuff as just part of my combination approach. It's just the treatment. And so I wish I would have started combining those treatments together and stopped doing these standalone that need to do it twice a week or 3 times a week with lasers or what have you, when, most of the time the results are very short-lived.
yeah.
And we could get 4 to 6 months of relief from using the combination approach with our toxins.
So I'm going to take this just real quick another step
Yeah,
because
yeah.
I know you're the question asker, but this triggered a really good.
Oh,
Hey, sorry. I knew it was going to happen tonight. Uh, Jarrod, that it reminds me of actually worked with a client that has taken your courses, loved them, is doing this in the practice. And one of the things that he realized was exactly what you said. The combination therapy was that key to having the best patient outcomes and unlocking their yes. And so one of the things we worked on was creating very simple to communicate buckets of care, these like combination therapy buckets based on how the patient presents and what they need clinically. Here are the options that they have.
are those
So,
like treatment packages, Michael?
correct.
Yeah. Okay.
I, I'll just, the example is if you're just doing appliances first, which this doc was, he would start with appliances and then go appliances and botulinum toxin, and then it was adding to PRF if there was joint degeneration in the CBCT. So the initial consult has the cone beam, the comprehensive exam, and the long conversation. But the first bucket of just the appliances was the support, that it was called support, and it had the explanation of the appliances, daytime, nighttime. Here's what we're doing. If you want to relax, we're going to support and relax relax the muscles, support the joint. And the third one was heal, because PRF, to your point, Dr. Cornehl, when you mentioned it earlier, we're actually healing the joint degeneration, not just addressing the muscles and the pain, which
Right.
is the core issue. So having those stair steps and the clear dollars for this one or this one or this one. And the way we priced it, because you've got per unit costs on Botox, different based on different distributors, but you've got a per unit cost. I candidly told them, I'm like, listen, unless somebody's done this aesthetically, no one knows what the heck you're talking about. Because if they go into the physician and they get it covered by insurance for a migraine, they have a flat copay. They're not getting charged per unit. So communicating in the way that they understand, give them a flat dollar amount. And the resistance I got was, well, I don't know. Every patient is different. Like, all right, give me a range. How many units on average per patient? And how many times can you do Botox in a calendar year? Maximum of 4 times. Not that they need it, but a max of 4 and an average of this many units. And we priced the Botox, the tier that included Botox, based on 4 sessions in a year, the average dose per patient. So there's some patients that might need 3 doses instead of 4. There's some that are going to be completely out of pain in 2. And you've addressed the joint and now they're fine because the structure is there and the muscles have relaxed. The
I love
patient's
that.
upset.
Yeah.
They're not upset when they paid the fee for the outcome. And I think candidly, there's a lot of exactness in dentistry that this is medical. I understand it's dental and medical, but just like sleep apnea, I mean, you're adjusting appliances in millimeters. If you get someone out of chronic pain, they paid you a fee and you got them the results. They're not counting the units of botulinum toxin that you injected and how many times. You got them where they needed to go.
Yeah.
Done your part.
I love it.
As a non-dentist, there we go.
Yeah,
I
no,
like
I
I
love that
like the
approach.
non-dentist perspective. That was good.
That's a great fee structure setup. I love that. I'll have to get some numbers from you.
speaking of numbers, Dr. Fernando Jane is a faithful webinar attendee. He asked point blank, would you be willing to share your consultation fee? Just the disclaimer, we have no intention of setting your fees. That's not for us to do, but Dr. Cornehl is willing to share. If he's willing to share, he can, or
Yeah, yeah, absolutely. So you know the way we approach it, because we're general dentists doing kind of a specialized TMD service for our patients. We charge what we would charge for like a emergency palliative or a like limited exam. I believe in San Francisco it's $350.
got it.
So it's not crazy, but it's not, $50.
Yeah,
So I started thinking about this. If they were coming in to see me as a dentist, and I was going to be getting them out of pain, right? It's going to be a limited exam in PA or emergency palliative in PA, and so I just kind of said, "Hey, why can't I do this the same? I'm also going to get the cost of the product that we're using, the toxin, and so the production for that visit is going to be in the at least 1,000. So and I didn't have to send out anything off to a lab or I just had to have the botulinum toxin in my office.
yeah.
Mhm.
So yeah, that's my fee.
Thank you for sharing that.
Of course, yeah, I'm happy to share fees.
One thing I forgot to say about the buckets or the treatment packages that was an after benefit that we hadn't planned right away is it specifically with Botox every 90 days when they're coming back or 120 whatever that cycle is for them when the nerve ends grow back and they're in pain and they come back to you for treatment. Now we're asking them for dollars again. And in your model, they know what it costs because you've pre-educated them. So they're coming in knowing that, but they're also associating the visit with the pain of the finances. And if we have a treatment package that extends beyond one visit, they start associating being out of pain with coming to the office, not the financial sting every time they show up.
Yeah.
Psychologically, that was a game changer for multiple patients because they made the decision up front and then didn't like it reduced their no-shows because they'd have no-shows because every time the person's coming in they're having to pay if they're already paid and it's financed or it's on a payment plan whatever the decision's done and now I just get to come and get care. That was a cool byproduct that we didn't expect.
I love
Yeah,
it.
that's a great idea. I like that. So, okay, so I mean, we're coming up on 10 minutes left. I know a lot of the questions that people have are surrounding case presentation, getting people to yes. One thing that Dr. Smith asked was, what do you do when a patient asks you a question that quote unquote stumps you? If you don't know how to answer their question, what do you do?
Get super clinical.
Yeah. Oh,
The
no. Oh,
biomechanical markers.
thanks, Randy. What do you do when a patient presents to you with something that stumps you? You know, uh, it happens. I would say the combination approach that I use is with these integrative strategies really works almost all the time on most patients, but not 100% of the time. Nothing's 100%. And so, the 10 other dentists that they saw and the physician and the ENT, they weren't able to help them either. So I don't feel so bad that I wasn't as successful. A couple things. I got to figure out, uh, I don't know if your meeting stumps me or like they didn't get better. Sometimes, there's these patients that are a little bit the negative type. And
Negative Nancy's.
they're not positive at all, and nothing's ever works for them, and you know what I mean. So sometimes you have to slow down, go back with them and have that conversation again, and pull out the little nuggets it's celebrate, find the wins to celebrate, because most of the time there are some wins to celebrate, and they just were expecting to go from, 10 pain to 0, but they're at 5. Well, that's a 50% improvement. That's better than anyone else got them to, right? So we just, or, they had 4 headaches a week and 4 headaches a month were migraines. And now they only had 1 headache since they've seen you last 3 weeks ago.
Mm.
That's amazing. But because they still had that headache, because they were at a 5, something broke down in communication. We didn't set their expectations. And so really going back, and celebrating those wins, and listening to the patient again, it all goes back to communicating and listening, I think. And then if you were meeting stumped me, like, I just don't know what to do, that's why we have our oral facial pain specialists. One thing that I wish I would also, looking back at my growth curve, I wish I would have built my networks sooner with specialists, physical therapists, sleep physicians,
Mm.
etc., pain specialists. The thing is, with the pain specialists, at least in San Francisco, no one wanted to go to the dental school, or they couldn't get in. So I ended up having to start treating them and figuring that stuff out. So anyway, that's what I do with those types of patients.
That's a perfect segue into Dr. Smith's question.
Yeah.
You want to hit that, Todd?
Yeah, I was just saying, like building out those next networks. Randy asked, now that there's a recognized specialty for pain and TMD, how do you recommend that we present ourselves? Do you present yourself as a dentist who treats TMD pain, or how do you brand yourself?
Yeah, I'm a general dentist who, his practice is limited to TMD pain management. I
Okay.
guess just like, a non-endodontist, right? That does endo for a living. They're not a specialist. We're not specialists. I would never want patients to think that we are. They know we're a general and restorative dentist, and we do general dentistry, but we also help treat pain. We also make their teeth look pretty, right? We also do cleanings. We also place implants, all that gamut. So, um, we're just we're a general dentist doing TMD in our practice to help those patients because they're suffering and they don't know where else to go.
Yeah.
Yeah.
And I think, to be very specific with the verbiage there, practice limited to specialty treatments, or limited to pain and TMD, or sleep and TMD, something like that. That's
Yeah.
if the practice is a specialty practice, but you're not a specialist, you're a general dentist with specialty training. The practice is limited to those procedures, and you are a general dentist specializing in. I think those that's the combination, depending
Yeah.
on what practice you're in.
Totally. Yeah, for us, we're just like advertised in our website. We are general and restorative dentists. So we just happen to do all these treatments.
Yeah.
Happen to have this amazing website with beautiful lipstick all over it that says, "This is luxury. Come here." All those aesthetic patients
His
too.
website does look good. It
Yeah,
does look good.
yeah.
Okay, so Jonathan Zembecki asks, is your goal to greatly reduce TMD pain on a new patient exclusively using Botox and maybe NSAIDs at first? Or are you doing a little equilibration, equilibration,
Equilibrium.
Equilibration.
My bad. My eyes just crossed. And or splint therapy as well. Speaking only to early and acute pain phase.
Sure. Most patients are finding us because, again, they have been to Dr. Google and done their research, and they heard that they could get out of their TMD pain by getting Botox. So most of the time, we are starting with this approach for my practice because that's patients are expecting to get out of pain. Their friend came in, we got them out of pain, um, and now they want to get out of pain too. So that's for that pain patient who we marketed to or that found us, just through other patient referrals, is we're doing that combination approach, therapeutic Botox, trigger point injections, and photobiomodulation. Now, existing patients, it depends, right? We might do a deprogrammer, like a COIS deprogrammer, to see if we can't get their teeth to come together, or their bite to come together. Is that how you said it, Todd? Their occlusion
Yeah,
corrected.
the
Do they
fifth
have
grade
an
level.
do they have an interference? Do they have a restriction? All it really just depends on what they're presenting with. So we might do that as well. Or we might, once they're in deprogrammed, we might find out, do we need to give their teeth a haircut? There's your fifth grade. Do we need to do an occlusal equilibration? Do we need to move their
Perfect.
teeth orthodontically, or do we need to restore some teeth, right? So it really depends. But I would say for the majority of our patients that aren't true dental patients that are seeking help, seeking pain management, they're coming in expecting to get Botox um, as a first line of defense. And then we go along that journey together to figure out the why. And that might involve looking at their airway, sleep, occlusion, etc.
Yeah, yeah, that's great. Well, let's see. We're about three minutes from the end. I believe we have all our questions answered, right, Michael? My
Uh,
technically, I haven't missed any questions that somebody has asked.
you haven't missed anything, but I've got a few coaching clients on here that are asking questions in regular text instead of in the Q&A. Um, so we've already answered the question about where could they take more courses with you, Dr. Cornell. We'll put the key links in here, the CE survey, all that kind of stuff. Um, you are also lecturing at Masterclass. That's our upcoming. For those of you guys that don't know, you haven't seen any of the emails that we've been sending for 10 months. That's our upcoming Business of Dental Sleep Medicine and TMD course in San Diego. It's on Coronado Island. We are very excited about it 3.5 weeks from now. If you don't have a room and you're not registered, we will miss you. We are oversold by 12 seats already. We have no more rooms at the hotel. We would love for you to be there next year. So if you go to the website, you will have access to early bird special. Click the link and sign up for that. As soon as we have that event launch for next year, it'll be sent out to you in an email. Other than that, I think we've got a CE survey to put up here. And I also, if they want to follow Dr. Cornell, I think I've got all four links and
Oh,
I'm in one shot to every.
I'll tell you. Yeah, I'm happy to answer any questions, offline if you think of something later on this evening or what have you. I'm happy to answer that. The easiest way to get a response from me is just follow me on Instagram, send me a direct message. I'd be happy to help you out any way I can. And you can also see, some of the courses that are coming up. Like the private one there surrounding the Pivot Masterclass, which is going to be amazing. So, yeah, I think you got it all right, Mike. I think so.
There we
You did a
go.
great job.
You,
Thank you.
I'll go buy
Yeah.
a lottery ticket when we're done here.
Thank
Yeah.
you.
Yeah, I encourage everybody if you have questions, reach out to Dr. Cornell on Instagram and definitely check out the courses. Just based off the value he provided tonight, you're going to get incredible value. So I know you're all over the country, Jarrod. You don't even know where you're going to be tomorrow, but
I
you're
don't.
providing a ton of value. So I appreciate what you're doing. I appreciate your time and for spending that time with us here tonight.
Absolutely. Thank you both for having me. I really appreciate it.
Okay, I should have done this earlier. Sorry, guys. That was your like mic drop thing. Todd, I missed a question.
What's up?
Your marketing services. Everybody knows you for sleep, but you
Yeah.
mentioned TMD and it's specific. I know
Yeah.
that it's new. If somebody wants more information about that, how do they get more info?
If they want, they can go to our website, and I have a free training that I put together on marketing TMD. I think on the homepage of our website, you can choose, a free sleep training or a free TMD training, or you can reach out to me. I can put it in the chat. You can email me. It's Todd at elevationmedia.us. I just put my email in the chat. If you have questions about marketing TMD, and like Michael said earlier, if you're at the point where that makes sense for your practice, that's really, really critical. If you don't have your systems in place, your workflows, and your clinical, then it doesn't make sense right now. But if you just want more information, I'm happy to share. So,
Cool.
yep.
Dr. Cornell, you have given us a lot to think about, and you've done way more than you got to share tonight. If you can impart one pearl, motivational, like do this, what's the thing that you tell people that are kind of on the fence of can I do TMD? Am I able to really get this off the ground? What would you tell somebody like that?
I would say 100% absolutely. For sure. You just need some training. You know, these procedures that we do, they're injectables. We do as dentists the most injections in the face every single day. We just happen to be doing them intraorally. But can you imagine doing it in an area where you could actually see, where there's light, there's no saliva, and a tongue fighting you? These are so easy to do. Us as dentists, we have this comprehensive knowledge and training in head and neck anatomy. We just have to relearn it, right? Because we're focused on teeth right now or whatever it may be. And this is easily learned. And we are such great injectors. Dentists are by far the best injectors. We think in millimeters. I think this is why we have great hand skills. But I teach, dentists, physicians, nurses, nurse practitioners, etc., hygienists, you name it. And the dentists by far just kill it right out the gate. They're so good. And so you can absolutely do these treatments and really become the go-to expert in your hometown. And add another revenue source for your practice, another way to get new patients in, and they're cash paying patients. It's not insurance based. So I say go for it. I don't see why you wouldn't.
Yeah.
Yeah. I like it. I like it. I'm excited. I'm excited to see you at masterclass, Jarrod, and hear your lecture. And I'm kind of excited to see Michael too. He's fun. Love you guys.
And yeah, you know what, everybody that hung out tonight, we know that you have finite time like we do, and you spent an hour with us talking about TMD. We truly appreciate you guys coming, and we hope this was beneficial for you. If you
Yeah.
got comments, please leave them in the survey. We will continue to do stuff to drop seeds and pearls and anything that we can to
Yes,
help you guys do great work.
yes, sir.
Yeah,
All right. Thank you guys so much again. And we'll see you in a few weeks.
sounds great.
All
Sounds
right.
good.
Adios.
See you all soon.
See you.